Enigma of diastolic function and heart failure with preserved ejection fraction. A call for better tools. Navigating the intricacies of diastolic dysfunction and heart failure with preserved ejection fraction, HFpEF, poses a considerable challenge, even within the medical community. While these terms have become familiar, grasping their nuances and the associated treatment protocols remains elusive. An illustration of this complexity is evident in the American Society of Echocardiography's ASE Diastolic Function Guideline, last updated in 2016. This guideline amalgamates various indexes in an effort to assess diastolic function. However, the efficacy of many of these indexes in truly reflecting diastolic function is questionable, and their combined use has not significantly enhanced assessment accuracy. HFpEF, a prominent subject of discussion, presents challenges in diagnosis for most physicians. Crucially, the diagnosis heavily relies on the assessment of diastolic function. Dr. J.K.O. of the Mayo Clinic contends that E', a singular index, suffices to describe diastology, raising doubts about the relevance of other indexes recommended by ASE. A better method for diastolic function evaluation emerges with the introduction of tau, the left ventricular diastolic time constant. Serving as the sole index directly linked to cardiac muscle power during early diastole, tau offers a simpler and more conceptually aligned approach to diastolic function assessment. Universal mathematical principles, coupled with the work of various researchers, have facilitated the measurement of tau in patients with mitral regurgitation or aortic regurgitation. Mindray commercialized a simplified tau formula in 2017, further validating its practicality. In comparison to ASE's guideline, tau measurement stands out for its simplicity and alignment with our comprehension of diastolic function. Notably, diastolic dysfunction typically precedes systolic dysfunction and often parallels or exacerbates with it. The next two guideline scenarios do not exist in real world. Despite Grandpa having severe systolic dysfunction, his diastolic function remains unaffected. How is this possible? Though the ejection fraction, EF, is normal, you have severe diastolic dysfunction, indicating heart failure with preserved ejection fraction, HFpEF. How long can I live? 5 years. Despite its merits, the non-invasive tau measurement has been overshadowed by the Harvard tau formula, a logically flawed theory introduced in 1992 by Dr. James Thomas of Massachusetts General Hospital. Despite its limitations, the Harvard tau formula has been clinically verified at the Cleveland Clinic and incorporated into ASE's textbooks and guidelines, where it persists. The continued inclusion of the flawed Harvard tau formula in guidelines hampers progress in diastology assessment, potentially impacting patient health and outcomes. In summary, while ASE's diastolic function guideline and the Harvard tau formula are widely recognized, their substantial limitations underscore the need for a more effective approach. Contrastingly, the recent tau measurement method offers a simpler and more accurate means of evaluating diastolic function. Overcoming past shortcomings and promoting the wider adoption of this method is an imperative task for advancing our understanding and treatment of diastolic dysfunction and HFpEF.